ovaries and we don't have ovaries. They have uterus, we don't have uterus, and all those kind of things.
Okay.
So likewise, we have this gland which is not, is not there in the women. So this is very common, and likewise in women, the most common one is the breast cancer.
I see.
And a lot of women, even they are
So
not aware of it.
what's the causes of the prostate cancer for men? Is there a cause?
In all kind of majority of the cancer, we don't know the exact cause, that what causes the
Even
cancer.
lung cancer with smoking?
Yeah, we can always associate,
I see.
like we associate lung cancer with smokers, but it happens that non-smokers also get. Like we heard about the tragedy of the wife of Christopher Reed, that she recently died and she was not a smoker. So it's unfortunately happens, but it's more common in those people, men and women who smokes, and that's why we are seeing it's more or spreading fast in women, because women are adopting more towards smoking. On the other hand, men are more quitting away
So
from
do you
smoking.
think smoking is worse for women? Medically, is there any researches on that? It's
That's-
more worse?
Smoking is worse for anybody.
Yeah.
And the first-hand smoking surely is worse. Even the people who are exposed second-handedly, it is even worse for them. And smoking is one of the worst thing happening, because this is something in our hand. If we decide, if we want to give a favor ourselves, we have to keep ourselves away. And especially it's very important in teenager that they should be avoiding it, because of the peer pressure, because of some influence from the media. You think you look cool when you are smoking, and you can attract a lot of other people around you, and they start getting into it. But I tell you that this is one of the worst addiction to quit. Once you get hooked up into it, it's very hard.
Sure.
We always advise people who smoke that quit smoking, but on the other hand, we like to help them to whatever help they need, because we know that it's very hard. It's not that we tell them, don't eat bad stuff and they can going away from some places, but it is very hard. So it is best not to get into this habit compared to getting into it and living into it.
Again, that's why we talked about prevention in the beginning.
Yeah, and this is one of the, if I just explain it a little bit, that when we talk about prevention, we talk about 3 stages of prevention: primary prevention, secondary prevention, and tertiary prevention. An example of primary prevention is to avoid having cancer of your throat, your esophagus, your stomach, your
Let's
lungs,
talk about, in
by
fact,
not
talking
just smoking.
Talking about that, it's very interesting. Cervical is becoming even a very common cancer nowadays. Cervical cancer in the neck.
Cervical cancer we usually talk about, which is common in female.
Just a common name.
In female, yeah. In women, like we all know that in their genital area, cervical cancer can be prevented. And how it can be prevented, that we suggest of any woman who is 18 or above, or who is sexually active, of having a screening done, which is called pap smear. And recommendations are different. Some agencies says every year, some says every 3 years, but it is very important to be done after you are 18 and above. And what it does, it pick up the bad cells if they are developing, and you can treat them, and you can avoid having a cancer.
Where is that location?
It's in the female part initially to begin with.
So why they call it cervical? I thought cervical is the neck part.
No, that's
not?
right.
But the terminology is
Yeah,
the same.
yeah, you're perfectly fine. Yeah, anything related with the gland is
Yeah.
also called cervical.
Exactly.
Like we have vertebrae, it starts from neck. we
No,
call
this
cervical
is
cancer.
this is medicine 101 here, by the way.
So this is like we call the cervical vertebrae, thoracic vertebrae, and lumbar vertebrae.
Right.
So yeah, the name is, you have to be a little differentiated.
I'm an engineer, by the way. What about high blood pressure? Very common as well,
Yeah.
just like cold anyway.
Yeah, very commonly occurring problem. It's what we call, it's like it's something.
Epidemic.
Yeah, that it's like slow poisoning. And usually what happens that your heart needs to pump the blood within your vessels. And sometime, like when we divide them, the majority of the time, 75 to 80 to 90% of time, we don't know what causes high blood pressure. And there are 5 to 10% of time we can say that if there is something wrong in your kidneys, if there you have some vessels disease, or if you have some hardening of your blood vessels, that may give you high blood pressure. But what happens that when you have high blood pressure, you build this excessive pressure first to begin with at your heart, which can affect and it can get disease, and that can show in the form of heart attacks. Same wise, this excessive amount of pressure can build over your kidneys, over of your brain, and blood vessels itself means the blood vessels which are present in your eyes, in your muscles, and everywhere, it can affect them, and it can give you all kind of diseases. So very important, and that's why, you know, the system what we created over here to go and see a doctor every year and have a physical, and that's where you pick up
Is that a
these
certain
things.
age? I mean, at the age of 40, after 40, 45, or that's 20s?
Yeah, in fact, what happens that blood pressure start getting checked even at the childhood. So these are the certain things. But there are certain physical examination are advised to have every year, and certain screening usually done at certain ages, like in men 50 and above, likewise in women, except certain other screenings we do earlier. And especially when we have a history. If we have a history that in our family, like my father, brother, sisters, uncle have prostate cancer, then instead of normal doing prostate cancer screening, we need to get it done earlier, like in age 40s. Same wise, women who have history of breast cancer in their parents, sisters, and in their family, they have to have screening done at 3 level. Means they need to check their breast every month, and they need to have clinical examination done by the doctor, and then at age 40, first time they have to have their mammogram done to see. Why? Because sometimes these growths are so small that if you do your breast examination, you cannot pick it up until they get to significant size. But at that time it might be late, so you do mammogram, and mammogram can pick up very small growths, and you can have that thing removed if needed, instead of waiting and grow them bigger, and then you are in trouble.
What about high cholesterol? I mean, I'm sure there is a connection between high blood pressure, high cholesterol, as well as being obese,
Yeah.
less mobile.
Yeah, same like blood pressure. It gives you so many other related problems. Likewise, high cholesterol, and what it does, it start forming small thickenings within the blood vessels, and that causes narrowing of your blood vessels, and that narrowing of blood vessels compromise your supply to your major organ or your vital organs. And when you don't get enough blood flowing through these blood vessels, and if your organs are deficient in getting their blood supply, their functioning get compromised for these problem related to that organ.